Yeah, I start by sharing a picture of a fountain. It reminds me of a fountain of youth, and I don't know if there is a fountain of youth, but if there were, I would believe that it would involve getting good sleep. And so I think as we age, sleep becomes more and more precious, so that when we are awake, that we're able to enjoy life a little bit more. I wanted to share a brief video with you. And this is from Matthew Walker. He studied sleep at the University of California, Berkeley. And just want to watch a couple minutes of this that really shares the importance of sleep.
My name is Matthew Walker. I am a professor of neuroscience and psychology at the University of California, Berkeley, and I am the author of the book, Why We Sleep. We certainly know that a lack of sleep will actually prevent your brain from being able to initially make new memories. So it's almost as though without sleep, the memory inbox of the brain shuts down and you can't commit new experiences to memory. So those new incoming informational emails are just bounced and you end up feeling as though you're amnesic. You can't essentially make and create those new memories. We also know that a lack of sleep will lead to an increased development of a toxic protein in the brain that is called beta amyloid, and that is associated with Alzheimer's disease, because it is during deep sleep at night when a sewage system within the brain actually kicks into high gear and it starts to wash away this toxic protein, beta amyloid. So if you're not getting enough sleep each and every night, more of that Alzheimer's related protein will build up. The more protein that builds up, the greater your risk of going on to develop dementia in later life. What are the effects of sleep deprivation on the body? Well, there are many different effects. Firstly, we know that sleep deprivation affects the reproductive system. We know that men who are sleeping just 5 to 6 hours a night have a level of testosterone which is that of someone 10 years their senior. So a lack of sleep will age you by almost a decade in terms of that aspect of virility and wellness. We also know that a lack of sleep impacts your immune system. So after just one night of 4 to 5 hours of sleep, there is a 70% reduction in critical anti-cancer fighting immune cells called natural killer cells. And that's the reason that we know that short sleep duration predicts your risk for developing numerous forms of cancer. And that list currently includes cancer of the bowel, cancer of the prostate, as well as cancer of the breast. In fact, the link between a lack of sleep and cancer is now so strong that recently the World Health Organization decided to classify any form of nighttime shift work as a probable carcinogen. So in other words, jobs that may induce cancer because of a disruption of your sleep-wake rhythms. We also know that a lack of sleep impacts your cardiovascular system, because it is during deep sleep at night that you receive this most wonderful form of effectively blood pressure medication. Your heart rate drops, your blood pressure goes down. If you're not getting sufficient sleep, you're not getting that reboot of the cardiovascular system. So your blood pressure rises. You have, if you're getting 6 hours of sleep or less, a 200% increased risk of having a fatal heart attack or a stroke in your lifetime.
So I want to stop there. I think it makes the point that I want to make, and that is that, good sleep really equals better health. We can't have good health if we're not having good sleep. And he pointed out several different examples of that. Specifically, I want to talk about, there's a lot of different types of sleep disorders. Sleep apnea is the one that I specifically want to talk about because it is mostly associated with a dental or oral condition. And really want to first dispel the myth that sleep apnea only occurs in people that are obese. Sleep apnea is there is an anatomical component to it. And I see this in patients that are very fit, very thin, But I think sleep apnea, obstructive sleep apnea, which is OSA, often kind of gets incorrectly tagged as a fat man's disease, and it really is not. What happens is when you're laying on your back, the soft tissues relax and they fall back into the airway, causing an obstruction, and then you're not able to breathe. Sometimes cutting off that airway, and one will stop breathing for 10 seconds. That's the definition of an obstruction. So if someone stops breathing for 10 seconds, and sometimes that may happen anywhere from 5 to 30 times an hour. And so if you can imagine what that begins to do to all of your other systems, it can be problematic. But obstructive sleep apnea is the condition that I want to focus on today. And I asked the question, does it really matter how we breathe? We need to get air to our lungs. So in this case, this gentleman is breathing a deep breath of air through his nose and getting air to his lungs. This gentleman is also getting air to his lungs. And this gentleman is also getting air to his lungs. But the way in which we're getting air to our lungs is very, very different in all three of those examples. The gentleman on the bottom with the mask, certainly the airflow is compromised. The gentleman up in the hospital, and that's purified air as well, but he's breathing in a different way. The way we breathe affects all of our nervous system. So we have a sympathetic nervous system and a parasympathetic nervous system. The sympathetic is the fight or flight, and the parasympathetic is the rest and relax. So when I'm breathing really deeply through my nose, I'm relaxing all of those other systems. When I'm running and in a state of stress and breathing heavily and shallow, that's going to upregulate the sympathetic nervous system, and all of those other organ systems are then affected by the way I breathe. I want to share with you another video that was done by a pediatric dentist, Dr. Jimenez, and it's about 3 minutes long, and it is jam-packed with a lot of information. So I want you to hang in there with me. About halfway through it, it starts talking about how the way we breathe affects our teeth. But after we watch it, we'll break it down.
The normal or physiological way of breathing is through your nose. Breathing through the nose permits to purify the air by the structures inside the nasal cavity. In that way, the air entering into your naso- and oropharynx, your throat, is not going to heavily affect the lymphoid tissue in the adenoids and tonsils, which is the last barrier to catch harmful particles in the air before it reaches your lungs. Besides clearing the air from harmful particles, nasal breathing stimulates the production of gases and substances in the nose, which are going to facilitate the entrance of the air in the lungs and prevent infection in your respiratory system. Mouth breathing allows the air to pass directly into your throat, where the adenoids and tonsils are located. In that way, the air entering into your body through your mouth has not previously been purified, and the lymphoid tissue in the adenoids and tonsils become the first defensive barrier against the harmful particles contained in the air. As a consequence, that lymphoid tissue overgrows, occupying a large volume of your throat. That makes more difficult for the nasal breathing, and you make a habit of breathing through your mouth. In order to breathe through your mouth, your lower jaw has to come down, as well as your tongue has to rest on the floor of your mouth. Breathing through the nose is the correct way, and so the tongue is able to rest on your palate, stimulating a normal growth and development of your upper jaw. Conversely, when you breathe through your mouth, Your tongue has to descend and protrude. At the same time, the pressure of your cheeks increases, pushing the upper jaw inwards. So the growth and development of your upper jaw is negatively affected, resulting in a narrow and high palate. The upper dental arch acquires a V shape instead of being a rounded dental arch. Therefore, your teeth do not have space to properly align. This also produces an incorrect swallowing function. Every time you swallow, between 1,600 to 2,400 times per day, the tongue positions low, staying away from your palate. That forces the tip of your tongue to position between your upper and lower front teeth. That pushes your front teeth to show out of your mouth, and your tongue resting on the floor of your mouth with the tip of the tongue between your front teeth. That is called an open bite, as your upper and lower front teeth do not touch when you close your mouth. All those dysfunctions, mouth breathing, incorrect tongue posture, open mouth, and incorrect swallowing are going to continue affecting the growth and development of your upper and lower jaws. And as a consequence, there is less room for your teeth and they become crooked. Remember, the nose is for breathing and the mouth is for eating. Breathing through your nose and keeping your mouth closed with your lips together is going to help your upper and lower jaws to grow and develop better. But more importantly, it makes you healthier.
Right. So a lot of information there. I want to just highlight some things. First, nasal breathing purifies the air, and it's the primary or the first way to purify the air. It then hits the tonsils and adenoids that then become the secondary filters. And if that's not happening, then if we're breathing through our mouth, the tonsils and adenoids become the primary filter and just become bigger and bigger and bigger. So I see that in patients quite a bit as we're looking in the back of their throat where the tonsils are just huge. And that tells me that they're breathing through their mouth and they're not getting that nasal breathing. Nitric oxide, I mentioned it produces these gases. So the nose produces nitric oxide, and it's a powerful antiviral, antifungal, antibacterial. And that's what we need right now. Our body is designed to filter all that bad stuff out of the air, but it has to go through our nose. The other thing that nitric oxide does is it's a vasodilator. What that means is it makes our blood vessels bigger, and that reduces our blood pressure. And so if we're breathing through our nose, we're going to be healthier. Our cardiovascular system is going to be not as stressed. And then the other components of this video that are really important is that our tongue posture really helps develop the upper jaw, and our swallowing habits develop the upper jaw. Our tongue acts as like a scaffold. And so it's pushing the roof of our mouth, it's putting pressure on the roof of our mouth to expand everything both sideways and forward. And so every time we're swallowing or as we're breathing, it's putting those very light pressures and helping the upper jaw grow and develop correctly. And then what that does is it helps us breathe better as we become adults. So nasal breathing then helps us sleep better, which then helps us have better health. And so that's the connection, this path that I want to take us on. I want to talk a little bit more about our tongue. When we are in embryo, we have connective tissue that's initially formed between different structures. And then as we grow and develop, this connective tissue is removed. It's called apoptosis or cell death. And so in the case of our fingers, we have this connective tissue. In this case, it just wasn't removed completely and didn't fully form the fingers. Well, that same type of connective tissue forms underneath our tongue. And that piece of connective tissue runs from our tongue all the way down to our toes. Well, as we're growing and developing, that apoptosis occurs, that cell death, it then begins to release that tissue. But it doesn't always fully release. And so many of us have what's called a tongue tie. where it wasn't fully released. And there have been a lot of new research that's developed that is showing that many other conditions are connected to this tongue tie. Now there's different variable or different degrees of tongue tie, but you can imagine this patient with the fingers that are fused together, they can function just fine. They can do everything that they would normally do. And other than an aesthetic issue, we probably wouldn't do anything with it. With the tongue, similar situation. Many patients have a tongue tie, but they've been able to function and manage and don't even know that it's there. And it hasn't been addressed because really no one knows about it. Final video I want to share with you, again, kind of pulls everything together.
Proper breathing is critical to a person's health. Having an upper airway that lets oxygen flow freely into and out of the lungs is necessary for overall well-being. But if the upper breathing passages are narrow or blocked, it makes breathing more difficult. During sleep, a lack of the necessary oxygen puts a strain on the heart and brain and may cause complications. Your dental provider plays a crucial role in identifying airway problems. They are often the first health professional to identify airway dysfunction because of the signs that can be observed within the mouth. A person's airway may be restricted due to certain anatomic features, such as a small mouth or throat, overly large tonsils or adenoids, or an elongated uvula and soft palate. A blockage of the upper airway during sleep is often due to the relaxation of the tongue and soft palate moving to the back of the oral cavity. The potential signs of a restricted airway include tooth grinding, tooth wear, tooth decay, having crowded teeth, nasal issues, obesity, mouth breathing, and snoring. Often, treating a dental issue like grinding or tooth wear will simultaneously improve a patient's airway and sleep quality, and lead to an improved quality of life. If left untreated, the constant strain placed on the heart and brain, coupled with poor sleep quality, can result in insomnia, chronic fatigue syndrome, fibromyalgia, gastrointestinal issues, depression, anxiety, nighttime teeth grinding, and cardiovascular difficulties like high blood pressure and stroke. Given the potentially serious complications, it is critical to work closely with your doctor to screen for airway issues and develop a treatment plan that meets your unique needs.
Our airway and how we're sleeping and getting good air is going to affect our teeth. If we're struggling to breathe at night, we're going to be clenching and grinding our teeth, which then leads to tooth fracture. If we're breathing through our mouth at night, we're going to have a ripe environment for gingivitis or bleeding. You might brush and floss and do everything that you can do, and then you come into the dental office and your tissues are bleeding, and you're like, what's going on? Well, potentially you're breathing through your mouth. Tooth decay is mouth breathing is a ripe environment for promoting tooth decay. So these are all dental issues that manifest themselves in the oral cavity when someone is struggling to breathe at night. And tongue posture is really one of the keys to that. The previous video showed that where our tongue is resting, if it's resting on the roof of our mouth or on the base of the floor of the mouth, is going to determine whether or not we're breathing through our nose or our mouth, which leads to better sleep, which leads to better health. So it's all very much connected. Again, the anatomy of our airway and how air flows in the airway then is determined by that tongue posture, determines nasal breathing, which determines better sleep and better health. So I want to share some more examples of how the teeth tell a story about the growth and the development of someone's airway and then how they're sleeping at night. This patient here, you can appreciate that there's some crowding. This is their upper arch. And the reason there is crowding is not because the teeth are too big, but the upper jaw is too small. The upper jaw never fully developed, and then therefore, now there's crowding. And the upper jaw never fully developed because the tongue wasn't there pushing it out of the way. Another example. Here you can see the tongue. This is the lower arch. And the tongue is resting on top of the bottom teeth. It's resting on the floor of the mouth. And there's really no room for the tongue. It looks like this patient might, if they were to bite down, they would be biting on the tongue because the tongue is trying to get out of the way, is trying to push itself forward, get out of the way of the airway so that that patient can breathe. Another example of the lower arch, you can see this, these are called bony tori. They're growth, extra bone growth. And so someone who is clenching and grinding their teeth is really biting down really, really hard and using the muscles of mastication at night in a way that's, they're putting more force on their teeth than they would if they were ever biting into a steak. Well, that constant clenching of that muscle begins to build the bone. And then there's this overgrowth of bone. So when I see that, it's a clue that the patient is clenching at night. The other thing I'm seeing is this connective tissue that I mentioned before, this tongue tie. The tongue, in this case, has good posture. And then another case here, similar situation. I want to point out this, sorry, my screens, this scalloping right here. So this indentation, what's happening is the patient is pushing their tongue forward, and those marks coincide with the marks of the teeth. So that patient at night is trying to get their tongue out of the way, pushing their jaw, pushing their tongue forward, and it's creating these marks on the tongue. Another thing I want to point out is on both of these cases, they are missing premolars. So in this patient here, there's 2 molars and 2 premolars, where in both of these cases, their premolar was removed. So in the 1970s and 1980s, that was a fairly common practice. When the upper jaws and lower jaws were underdeveloped, there wasn't room for the teeth. And so the dentist or orthodontist would go in and remove one of a set of teeth, and in order to make them straight. And in this case, you know, they're relatively straight. But what that tells me is that the jaws just never fully developed, and now it's manifesting in sleep apnea. One other case, you notice the wear on the teeth. These teeth are really, really short. Well, it's because this patient at night is clenching and grinding their teeth, trying to move the lower jaw forward to open up the airway so that they can breathe better. Well, that constant grinding then begins to wear on the teeth and make them short. And then finally, this patient, again, has some crowding. You'll notice the very deep palate. So right in here, that's very deep and very narrow. The roof of the mouth is also the base of the tongue. And so if the roof of the mouth is very narrow, the base of the nose, not the base of the tongue. If the roof of the mouth is narrow, then the base of the nose is narrow. And so then the flow through the nose is not as prominent as it would be if those nasal passages were wide open and broad. So when a patient comes in and we're doing a dental examination, these are all clues that make me ask questions. Well, how are you sleeping? Are you snoring? Snoring is an indicator that there is a poor passageway in the airway. And if we're able to determine that there's potentially a sleep condition, then we're able to do something about it. Typically, that means getting a sleep test. I'm not able to diagnose sleep apnea, but I'm able to see signs within the mouth that clue me in to say this patient is potentially suffering from a sleep disordered breathing condition. Then we're able to get the sleep test, get a sleep diagnosis, and then treat appropriately. So again, this path to better health, our airway is helping to determine the growth and the development of the jaw. When there's underdevelopment of the jaws, then there is crowding in the teeth and the dental arch anatomy is constricted. Then when that dental arch anatomy is constricted, it then is this cycle, negative cycle, where it's constricting the airway. And all of those then lead to poor tongue posture, poor nasal breathing or mouth breathing, which then reduces our sleep and decreases our health, or the vice versa is true. When we've got good tongue posture, we can have good nasal breathing, better sleep, better health. So this is what we're doing in our office. We're through technology, we're able to do a 3D scan of your airway. We're able to look at your airway right here and measure volume. We're able to look at the soft tissue. We're able to look at the tongue. Here's another example of, we just pulled out the airway, and you can see right here there's a constriction. This is where the patient's volume is pretty narrow, and what that equates to is poor sleep. If we could just move so this is your upper teeth, your lower teeth, your tongue is right here. If we could encourage the movement of the tongue this way by encouraging growth and development, or encouraging the upper jaw to move forward and the lower jaw to move forward, then we will be able to open up this airway and the patient will be able to sleep better. We not only look at the mouth, but we look outside the mouth. So we take photos, and these photos give us clues to what might be happening. We're looking at their eyes. A patient that is suffering from sleep deprivation or poor sleep is going to have dark circles under their eyes. We're looking at neck posture. Someone that is moving their head forward is essentially trying to open up their airway, not only at night, but during the day. We're looking at asymmetry. We're looking at shoulders and their posture. All of these things give us clues as to how a patient may be breathing. Of course, we take photographs of the inside of the mouth as well, looking at the palate, looking at the teeth, looking at the tongue. We take a 3D model of the teeth, and we're able to analyze that when a patient's out, not in the office. And then these are the different types of therapies, oral appliance therapies. When a diagnosis is made, we get a sleep physician involved to make a diagnosis, but there's a couple different options. One is a simple night guard. And a night guard will protect the teeth. It will prevent the teeth from wearing down and getting short and cracking and those types of things, but it doesn't address the underlying issue, which is the airway. There are other oral appliances. This one right here essentially moves the lower jaw forward, and the patient would sleep with that. And as they're sleeping with that, then it opens up the airway, it gets the tongue, it creates space for the tongue. And this is traditionally what dentists have used to treat sleep apnea. But there's another appliance that is relatively new and is exciting because it's not only addressing the lower jaw, but it's addressing the upper jaw. It's expanding the palate and expanding the upper airway, remodeling the upper airway to allow more space for the tongue. And in this case, the patient would be wearing it at night as well as during the day until that remodeling has occurred. And then after that, they don't have to wear it anymore. So that's really exciting. It's a non-surgical treatment. That would be another way to treat this condition, is surgically move the upper and lower jaws forward. But these dental appliances now can non-surgically influence and remodel the airway so that it creates more volume. And then finally, on the right here, these are appliances that children can wear as they are growing and developing to prevent this in the first place. And so that's really exciting for us, is that we're able to really play a preventative role and help patients learn to nasal breathe, get the tongue in the right position, help the skeletal bones grow the way that they need to. Another kind of side note is that the maxilla, the upper jaw, is connected to 9 other bones in the skeleton. And so if we can influence the maxilla to grow and expand correctly, then that's going to influence a whole lot of other cranial bones, which just assist in the growth and the development and the breathing. And then finally, I just wanted to share, a patient came in last week. I thought this was kind of perfect timing. So he had been going to bed at 10 o'clock and then falling asleep very quickly just because he's exhausted. He would wake up at 1 or 2 a.m. in the morning every night. He was diagnosed several years ago with sleep apnea. He was treated with a CPAP, which is essentially is a mask, and it blows air through your nose or through your mouth and gets air to your lungs while you're sleeping because of that obstruction that has occurred. And he said, I would go through the day pretty sluggishly and just make it through the day. He was doing this for years. We moved him to a dental appliance, and in 3 weeks, he came back last week, and this is what he said. He said, "I can't tell you how energized I feel every day. I'm much more active, much happier. My mood is increased. Even my wife has noticed I'm a happier person to be around. I have dreams now. I haven't had dreams in many, many years." And so this is just really exciting for us, because most patients, when they go to the dental office, we get a lot of, "Oh, I don't want to go." And when we're talking about sleep and helping patients sleep better, it's just really exciting for both the patients and us to help treat that. And so absolutely, the teeth tell a story about what's going on in your sleep. And the mouth is the entryway to, the mouth and the nose is the entryway to our respiratory system. And our respiratory system plays a role in all of the other systems that are in our body. And we pay a lot of attention about what we eat, our digestive system. We pay attention about our blood pressure, our cardiovascular system. We pay attention about exercise, but we don't really pay attention about how we breathe, because it's just so natural. But it turns out how we breathe is really, really important.